Good morning and welcome back, everyone. It is 7:24. Students, faculty, and staff are teaming up over at Dell Medical School on UT's campus to offer specialty care to people all over Austin. And this month, the clinic is focusing on team-based care. So joining us to talk about that is Dr. Christina Salazar over here and Dr. Amy Young. Thank you both for being here.
Thank you. Good morning.
Good morning. Let's start with you, Dr. Salazar. Tell me exactly, what does a team-based approach care mean?
Thank you. Basically, when we do that, this is a way of being able to provide resources for patients that they otherwise wouldn't have had. We collectively meet and collaborate to discuss patients before they even walk in the door.
Okay.
We look at all of their medical records, and we have specialists such as nutritionists, physical therapists, urogynecologists, minimally invasive specialists in surgery, and all of these specialists sit around a table and discuss the patient in each kind of unique way that is individualized care, and then we move into actual patient care on a one-on-one basis with that knowledge that we've acquired through doing a team-based approach.
That makes sense. Dr. Young, how does that help the patient? I know how that helps the doctors kind of all get on the same page, but how does that help the average patient who walks in and gets this different kind of care?
So there's probably 2 or 3 ways where that really helps a patient. Normally, if a patient needed those resources in this community, they would have had to leave that particular clinic site, travel to another clinic site, travel to another clinic site, and travel to another clinic site to be able to get the same services. So you can imagine that affects time, and it also affects distance. But the other thing that's really unique about this opportunity is it allows all of the providers in a care team to have that real-time interaction. And so it's not as if you have to wait for the transmission of a medical record, or you depend on the patient to communicate to you what the last provider actually did for them. It's real time where that happens. So you can grab your colleague, hey, Dr. Salazar, hey, come look at this patient with me. And so you've got that preparation, which is really unique and different, and actually saves a patient appointment in most cases. But you also have that real time interaction and communication.
And this way, are you able to catch problems that may arise quicker as opposed to later?
It is. The patients are really seeking really specialized care at this point. We're just starting to do more generalized care. But right now, the 3 conditions that we treat in the Women's Health Institute are chronic pelvic pain, pelvic floor disorders and incontinence, and vulvar disorders. And so they're really very specialized diseases, but it's this team-based approach that we really address the entire patient as part of this particular process while we address this one condition.
And Dr. Salazar, what kind of response are you getting from the patients already on this?
It's been incredible. They've had an experience where for their own primary doctor, it's overwhelming for them in those situations to be dealing with complex gynecological conditions, and many times it's exhausting the resources of those primary doctors. And so they've sought us out, either self-referring or being referred by their gynecologists themselves. And that they've experienced a situation where they have been able to get some answers to questions that they've never had answered, and get some relief from some chronic pain, for example, that is really changing people's qualities of lives.
That's huge, to be able to have a team of doctors work with you. It makes you feel like something is getting done and that you matter, which is always nice to know when you go to the doctor. So you can go to uthealthaustin.org for more information, and we'll link that up to our website at kxan.com. Doctors, thank you for being here and waking up early on what hopefully is your day off.
Thank you. Thank you so much.
Thank you. Still